According to Rubenstein and Josephson, 2006, falls are a common and complex geriatric syndrome that cause considerable mortality, morbidity, reduced functioning, and premature nursing home admissions. According to the Center for Disease Control, 2012, among older adults, those 65 and older, falls are the leading cause of injury death. They are also the most common cause of non-fatal injuries and hospital admissions for trauma. They proceed to report that 1 out of 3 adults aged 65 or older falls each year, but less than half talk to their healthcare providers about it. This presents to primary care providers an opportunity to make a positive impact in regards to falls. For this case study, the patient is an 85-year-old white female with a history of dementia, previous TIA, unsteady gait, a use of a walker, osteoporosis, and diabetes. The patient presents after suffering a fall from about 16 inches. She was going to get some landscape workers at her house some cold drinks and was walking down the stairs and missed the last step. In doing so, she proceeded to fall forward onto the grassy area and the pavers just adjacent to the grass. She's now complaining of bilateral ankle pain, with the left ankle being greater than the right, rib pain and contusions over the ribs, bilateral wrist pain, redness, and swelling, a head contusion, and a little bit of memory loss surrounding the event. This patient was taken to the ER via ambulance. She was found to have a left and right ankle sprain, with the left being greater than the right, a fracture of the fourth and fifth ribs on the left side, bilateral scaphoid fractures in the wrist, contusion of the forehead, and a mild concussion. She stayed in the inpatient area for 2 days and was discharged to a rehab center. Although this fall appeared to be mechanical in nature, the differential diagnoses were also discussed with the patient to rule out syncope related to diabetes or hypertension, or altered mental status related to drowsiness from medications or dementia. These do not seem to be likely causes of the fall. The plan of care will be to treat the immediate injuries and to finish physical therapy in the rehab area. Also, education about further prevention of falls and fractures will be conducted, and an evaluation of the home for safety and assistive devices will also be conducted. Upon evaluation of the home, it was found that the home has an entry on the ground level. The main living area and the master bedroom is also on the ground level. The only areas of multi-level is the back porch, which has 5 steps, an attic, and a basement, which the client says she no longer uses. There's no pets and no throw rugs, and there's rails at all entries, bathrooms, and shower. There are also traction devices in the tub, bathrooms, and at all entry and exits. Falls have a number of causes. They can be mechanical in nature and can be caused by trip hazards such as rugs, steps, unsteady gaits, etc. They can have a physiological component related to syncope and altered mental status. It also can be caused by polypharmacy or environmental factors such as pets, slick surfaces, or other environmental factors. This figure demonstrates factors that contribute to falls. As you see on the left, middle age, to the continuum of the right being elderly. And then the far left axis is the threshold for falls. You'll see that the middle age have a high threshold because they don't suffer from chronic disease, medications, or mobility loss. But as someone gets older, these things become more of a factor. The individual factor that could also affect this is a patient with acute illness. This means that the elderly are at a higher risk, and all of the areas need to be evaluated. These areas that need to be evaluated are chronic disease, medications, a reversible acute process, and mobility loss. This patient has been previously educated on the risks of falls, but factors that contributed to this issue this time was that this client was a homemaker. She was accustomed to being a good host, and she felt that the landscapers needed a cold drink of water. She tried to navigate the steps, but neglected to use the handrails that were in place, and she took a step onto an uneven surface and failed to maintain points of contact with the assisted devices. What should a primary care provider consider when trying to strategize to minimize the impact of falls? According to Fuller in 2000, elderly patients who have fallen should undergo a thorough evaluation. Determining and treating the underlying cause of a fall can return patients to a baseline function and reduce the risk of recurrent falls. This can be achieved by remembering the 3 phases of prevention. Primary prevention is preventing the falls in the first place. Secondary prevention is preventing fractures resulting from the falls. And tertiary prevention is to optimize the quality of living or to minimize the mortality and morbidity due to the falls. Some simple things that can be done to prevent falls would be a simple home evaluation for assistive devices. Consider walkers, handrails, ramps, traction devices, etc. Have the primary care provider or pharmacist do a review of medications. Make sure that the patient's not on any medications to make them drowsy or dizzy, and to remove any environmental factors. This would be considering the removal of pets, throw rugs, making sure there's no wet conditions, etc. This figure shows an adapted checklist that a family provider can use to do a home safety checklist. Secondary prevention is to prevent fractures. The most common and most efficient way is exercise, vitamin D, and calcium supplements. Additionally, patients that need it, osteoporosis treatment is necessary. And lastly, tertiary prevention is necessary to prevent morbidities and mortality. It is important to prevent secondary infections such as pneumonia, UTI, osteomyelitis, etc., and then also to prevent readmission due to falls or for other conditions. This patient actually lucked out. For her age, she ended up with relatively mild injuries. She went to rehab. Following rehab, she went to physical therapy and then has been followed by a home health nurse and went home with reinforced education related to falls and fractures. She returned to a lifestyle with a similar quality of life that she had previously. Thank you very much.